And thank you to all our witnesses for very interesting testimony. I will confess I had not heard of the Canadian Centre on Substance Use and Addiction until we came here to study it today. Even though I've been a practicing physician in Ontario for many years. However, when I look at the purpose in Section 3 of the Act, it certainly sounds an incredibly worthy purpose to promote increased awareness on the part of Canadians of matters relating to alcohol and drug abuse and their increased participation in the reduction of harm associated with such abuse, and to promote the use and effectiveness of programs of excellence that are relevant to alcohol and drug abuse. And certainly the board members that we heard from obviously have a great deal of experience themselves in relation to their own careers and so on. But my first question is for you, Dr. Caudarella. From a scientific point of view, I presume you collect data, first of all, as to the prevalence of substance abuse across Canada. Do you have full cooperation from provincial ministries, territories? How do you access the data to know the size of the problem?
Thank you. That's an excellent question. So there's a number of different things that we undertake. The first, as I mentioned before, we have a Canadian Substance Use Costs and Harm Study. Part of that is to look at over 20 different administrative databases, all the surveys that are done, all the vital statistics. And with that, we produce what we feel are the country's best prevalence estimates. It's where we see that alcohol has gone down, cannabis is increasing. We want to use it increasingly to help communities plan more for the future. In addition to that, we recognize that data is complicated. So this is where our network comes in, where we take all that data from drug seizures and surveys, and then we match that to what are everything from cops on the street to doctors in emergency rooms feeling and seeing, and how does that connect? It's why we've been able to produce recent reports on new additives in drugs or why deaths seem to be decreasing. And then in addition to that, we're working very closely with provinces and territories around some very specific data points. Right now, we're engaging in understanding what are both the number of treatment beds available in this country, but also what are the needs in each jurisdiction, and are we meeting them appropriately? We're looking at what services, basically all intended. We don't want to create data that's just on a shelf. We want to create data that people are action to use and that we're told people actually need. So we're very proud of the data work we do, and we're really looking forward to doing more and more in collaboration with literally hundreds of organizations in the country that we're very thankful to work with.
In other words, many of these organizations use your data and adapt what they are doing, presumably based on what the data tells them.
Yes, in addition to the data being very frequently referenced in provincial legislature, federal pieces, what we're hearing more and more is that, again, at that local level, people are using it to make decisions. It's why, for example, in our most recent project happening here in Ottawa, we're trying to take some of those costs and harms, some of those data points, and actually then apply them at this local level. Because ideally, as you're doing more and more, you should be seeing less criminal justice costs, seeing more appropriate housing costs, different pieces around this. And so we do see a lot of use of it, but we're pushing ourselves. And this has been a big goal of mine over the past 3 years that I've been here. You're a physician. You admit you hadn't heard too much of us. We are really working to change that. And this is part of why we're present at every big conference happening. We have relationships now and partnerships with most of the major organizations. We're working with cardiologists. We just published recently, for example, how they can do more to help patients who use drugs. So we're trying to reach people where they're at. We're working with primary care providers on alcohol to try and help them understand how they can do more to help people around cannabis as well. Physicians right now don't know what to say when people come through the door and say, should I smoke pot or not? And so this is where you're right, and we're actively working to have a bigger and bigger presence. And we're every day we have more partners. It makes me very proud that we're working more with people.
1 minute, 10 seconds.
And so maybe you could give us an example of the Act actually references programs of excellence. Could you point to a specific initiative that seems to have been resulting in positive effect?
Absolutely. This is where I'll talk about our small cities initiative a little bit. Again, we want things that land in people's backyards better. It's not just does it work in the evidence, is it implementable? So 2 projects that came up and we were able to feature, one was in Lethbridge. It was to say that, you know what, if that day you decided you didn't want to use drugs and you wanted help, you could find a low barrier job. Yes, oh, sorry.
30. You've got 30.
You could find a low barrier job that day to help clean the streets and help build towards it, and you'd be paid for that. Similarly, in our small cities, we worked with Timmins, Ontario. Suboxone or opioid agonist treatment is still hard to come by, and we don't have high enough treatment rates across the country. What they did is they got their paramedics to be able to dispense on the site so that somebody didn't need to see a doctor right away. They could start feeling well that very minute. I just don't want to look away from some of the best innovations happening in some of the smallest places in this country. And I think one of the biggest lessons we've learned is we don't need to just look at Toronto, Vancouver, and Montreal to see what's happening. There's some best practices coming from across the country, and our job is to make sure that those are interconnected.
Thank you, Dr. Cook.